This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's a beautiful day outside on this Memorial weekend. I hope you're outside playing and listen to me as you're, driving through the car, walking around. You got your headsets on. But nevertheless, after the program, make sure you get out and enjoy the day because it is fantastic. It's beautiful outside. We're here at 888-630-9625. That's 888-630-9625. Love to take your calls on any subject that you have in mind. Perhaps you've had a problem and you've tried everything you can think of. You come up with the same old thing, nothing that really works permanently. Let's see if we can kind of look through the weeds a little bit and make a difference on your health and get you off of some of these drugs and medications that you've been taking forever and put it in your hands. My book, Health is a Do-It-Yourself Program, Ageless Health, Health is a Do-It-Yourself Program, was simply written to show you that you have control capacity in virtually everything that you do. And, there's that thing where you try something that doesn't work. You try something that doesn't work, and it gets you kind of upset, right? So there's reasons, though. There is a why is that. I'm going to go through a couple things today that I want you to understand. We're going to talk about a couple of things that are in the news that I think you need to know about, but also we're going to talk a little bit about blood pressure today. And that's one of those things that can happen to all of us suddenly out of nowhere. It can happen at different times. It can be up at one point and down at another time, and you say, this is not me. But we forget that blood pressure changes based on many different variables, and we want to talk about some of those variables today. It's had me kind of interested because of a couple of things that have been happening in my practice. So the last several days I've been kind of looking through the literature just to kind of bone up on a couple of things that I had heard about but wasn't sure of the application. But we'll talk about that. So if you got a blood pressure problem, today is going to be a day really to pay attention. In the news, there was an interesting article on vitamin D, and you've heard me, if you've been listening to the program, you've heard me say that in our area, in the Washington metropolitan area, vitamin D levels are notoriously very low. And if you look at the laboratory guidelines, they run deficiencies anything under 32, but anything above that, most of your physicians will say are really okay. Not so much. There's these things called functional medicine normals. That's where your body maintains itself at the highest optimal level when it comes to protecting you. So what do I mean by that? Well, for example, let's take vitamin D. Vitamin D3, which is a natural form of vitamin D, works the best when you're north of 50 units. Now, we just said that 32 units is the laboratory low. So sometimes your doctor says, you're 40 units, you're 35 units, you're fine. Want to get it up a little bit, but the truth of it is that your target range is even north of 50. It should be somewhere around 75 to 85 for good supportive optimal health. And then when you're at that level, your risk of coming down with anything from colds, immunological conditions, cancers, things of that nature are dramatically reduced. And the studies are there, and there are tons of studies now that will show you that that's absolutely true. But there was another one that I wasn't aware of that came out in a recent research article, and it was the project was done at Children's Hospital of Philadelphia, and they published results in which these children were given 7,000 units of vitamin D3, and what they found, and the children that they were using were children that were HIV positive, and these were from young children to young adults. And the supplement used in the trial was very straightforward, very clean supplement. And over a 12-month period, 50 of these HIV positive people, ages, by the way, the age range was 5 years old to 24, almost 25 years old. They were given this level of vitamin D, and they saw that the levels would jump up significantly. And after 12 months, they maintained a solid level above what was very deficient. But what was significant about this is that these children who were HIV positive and these young adults who were HIV positive had very low levels of vitamin D3. So there's a correlation there, right? So vitamin D3 supplementation was used in comparison to a group of kids that were given a placebo, well, basically nothing. And what they saw was a significant increase in the levels of something called T helper cells and something called CD4 cells, and a reduction in the viral load that is directed by an RNA portion of the genetic map. This is significant. It tells you that when your vitamin D level is up and your immune system is solid, you have a better chance not only of recovery, but you also have a chance of not getting things in the first place. And we've talked about people who, have been exposed to things like HIV and other type of viral patterns repetitively, and they never come down with any exposure whatsoever. Their blood says no, that it wasn't in their life. So think about this. What makes a difference between people like that and people who come down with almost anything? It's interesting. Keep your vitamin D3 levels high. Don't take it, if the only thing that you really have to worry about is to keep it under 100 units when you do a blood test. Another little thing, K2 improves functioning of your arteries, and it allows you to be more protected from cardiovascular disease, particularly thrombus. With thrombus are plaques that build up. And, these thrombus formations seem not to be there at the levels that, other people form if their vitamin K2 is at normal levels. So there's all kinds of things that are coming out now that we've talked about for years, and suddenly they're being substantiated across the board. I really, really want you to be the master of your ship, do all the reading, ask the right questions. As I've told you many times, don't believe anything that you hear. Do the research and then have half it. One half of what you read might be accurate, but always ask the question, who is written, who is telling, and what do they have to gain by it? And by the way, who stroked the check for it? There's that Wizard of Oz behind the door that you really have to get the answers from. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. We're going to talk a little bit about blood pressure problems. When I was in school, many, many moons ago, as my son would said, when the dinosaurs ruled the earth, but nevertheless, blood pressure was one of those things, just like cholesterols and so forth, that if you were around 135, 138, it wasn't a big deal. That was kind of all right. And as long as that lower pressure, the diastolic, the down pressure, is in the neighborhood of about 72 to 80, you're probably, doing quite well. And a trained athlete or somebody that is in extraordinarily good shape is going to have blood pressures that are even lower than that. My blood pressure generally runs about 116 to 118 when I'm not really working out real hard. It was only because I do certain things, and bottom pressure is about 70, 71, 72. If I start working out a lot, it shifts even more than that. My resting heart rate goes down. So here's the deal. There's a problem with blood pressure, because if your blood pressure is too high, it's going to pop things. And you got to know what's happening, and it varies during the day. At nighttime, it should be the lowest of the day. In the daytime, or in the morning when you get up fresh out of bed, it should be the highest of the day. And then it should vary relative to the things that you do and don't do. So uncontrolled high blood pressure, when it gets up there and stays up there and it doesn't want to move, is serious. It can lead to strokes and heart attacks and things of that nature. If someone that or yourself has a constant hypertension or high blood pressure, and we're for our sake of argument, we're going to say a lower pressure that's around 90 or more, and an upper pressure that's above 145 or more. In that area, if it's constantly above those areas, there's a problem. So let's talk about it. Let's talk about the things that can do that, because I found out some things that I'd been aware of, but I wasn't really, conversant in it. But today I am, because that's what I do, is I go out and dig out things. So will your diet, will your lifestyle, will your emotions increase your blood pressure? Resoundingly, the answer is absolutely, positively yes. So here's where we get into that structural, chemical, emotional piece. If you're sitting in your chair all day long and you're not moving around, you're at a desk, you're working, you're constantly doing those kind of things, you catch as catch can when it comes to your diet, and you're stressed. You internalize stuff, or, it's just constantly there. You never get a break. Will your blood pressure go up? Probably. It'll probably start climbing. And it can be different times of the day. Some of us go to bed with things in our mind. Some of us get up in the morning with things in our mind. Some of us chew on it all day long. But let's talk about pieces of this, one piece at a time. Are you on a high grain diet and low fat regime? So lots of grains and low fat. If so, guess what? You're out of luck, because everybody's been telling you to do that. Keep your fats down and keep your grains high, because nutritional combinations like that will actually increase your blood pressure over time. There was an article that was published back in 1998 in the Journal of Diabetes and reported that nearly 2/3 of the people that they looked at were insulin resistant and also had something called high blood pressure. Okay, what does that have to do with anything? Well, insulin resistance is directly attributable to high sugar contents and high grains in your body. So if you're eating things that are converting to sugar quickly, or if you're eating a lot of sugar, guess what? You got a problem, and you're going to see your metabolic patterns change. Your blood pressure is going to go up. You're going to increase your inflammatory responses. So chances are that hypertension in your situation, or these particular situations, are uncontrolled or poorly controlled blood sugar levels, and these problems go hand in hand. So what we want to talk about today is we want to talk about the other things that cause hypertension. There's going to be one that we're going to mention that you might even think about. And what am I talking about? I'm talking about fructose. Fructose can cause your blood pressure to go right through the ceiling, can skyrocket like overnight. And the first thing you need to do if you want to control your blood pressure is you got to remove the sugars and the grains from your diet, but particularly something called fructose, until your weight and your blood pressure have normalized. Now, does this run true for everybody? No, but again, I want to share something with you that I've been, kind of playing with in my brain because of a very specific situation in our practice. In any type of bread or pasta or corn or potatoes or rice, those things are going to cause your insulin levels and your blood pressure to remain elevated. They're going to keep them up. So if you're eating those things, guess what? You got a problem. But you're saying, okay, fructose. I don't drink sodas, because when we think about fructose, we're thinking about sodas because that's been the hammer that we've been waving for a long time. But here's the D. Where do you come from in your diet that you're getting fructose that you're not even thinking about? It's called fruit. A lot of you eat tremendous amounts of fruit. Fructose breaks down into a variety of waste products that are bad for your body. One of them is something called uric acid. And uric acid is going to drive your blood pressure. So if your uric acid starts coming up, you got a problem. Now, blood pressure goes up and it inhibits something called nitric oxide. You've heard all the commercials about nitric oxide stimulators, increase the blood supply and oxygenation, to your blood vessels. And by the way, guys, that's what your Viagra's all about, and Cialis, that's what they do. They increase nitric oxide directly in a big shot. So nitric oxide suppresses, and leads into increases in hypertension and blood pressure. So, and there's study after study after study, but we continue to ignore that. So we got to know how much fructose we can actually have, where are the places that we find it, and in fact, does it cause a problem? And we're going to talk about that. We're coming up to a break, but we're going to get into the mix of this thing because it's important in our practice that we try to find out all the different pieces of those patient or 2 or 3 or 5 that doesn't respond even through what we do with manipulation and acupuncture and good diet patterns. And there's always the one that makes me go to bed at night and worry. And we're going to talk about that when we come back. We're here at 888-630-9625. That's 888-630-9625. And when you want to talk to me when I'm not here, the easiest way is to go to the website. Go to rosellecare.com and send me a note, and I will respond. Don't go away. Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. Indeed, I'm in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on anything that's bugging you. We're talking about blood pressure problems and some other things, and we just said to you that one of the things that can kind of spike your blood pressure depends on several other factors as well, but is fructose. And fructose, we know that there's corn fructose, which stay away from completely 100%, don't even get it near you. But there's also fruit, and fruit is one of our main sources of fructose. And for some people, apparently, fructose can drive blood pressure and can spike it and give you an inflammatory resistance problem, increasing your risk of diabetes and other things as well. Interesting book is called The Sugar Fix by a guy by the name of Johnson. You can look it up and find it, and he talks just about this. They're talking about the allowable level of fructose. If you have a fructose-sensitive situation, it's about 15 grams a day, which is about a half of a cup of fruit across the board. And we're going to talk a little bit more about that, but the phones are lighting up, and I don't want to ignore any of you, so let's get to that first. Rick, West Virginia, how can I help you?
Yes, how are you today?
I'm doing well, my friend. What's on your mind?
Well, I have three things I wanted to talk about. I have high blood pressure. I do have high blood pressure.
Okay.
I am overweight. I've been trying to lose the weight, and sexual. My sex life is not good anymore. Is that the reason why? Because I've been in a car, high blood pressure.
Yeah, Rick, how old are you?
I am 47 years old.
Yes. So let me hit all of those at one time because they're all interrelated. They're all connected. What you're doing is when the blood pressure goes up, we can get into the whys and we take the rest of the program. We'll talk about it a little bit today, but if your diet has sugars, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten additives, preservatives, and GMO type of products, you're going to develop something called an insulin resistance pattern. That's like taking all of these little cells that need certain things and putting a block in front of it that they can't transport into. So you can't get the good stuff into the engine to make it work. So typically, if you're on blood pressure medication, one of the side effects is impotency. Your sexual drive is going to go down the tubes. If you're on blood pressure medication, it's going to stop other processes in your body. So they're all linked hand to hand. So if you're overweight, it's telling you that your body's storing fat. And if that's the case, that's the first place you start, is with exercise and dietary patterns that are supportive of your body, not destructive. Weight comes on in a couple different forms. You've got bad fats and you've got fluid types of fats. Those show up in the initial stages because of stress-related type of conditions. Cortisol goes up first, and when you do that, you start holding onto fluids. You start holding on to certain types of fat molecules in your body. Not a good thing. But now you go to your doc, and your blood sugar's coming up a little bit, your blood pressure's coming up a little bit, your blood fats, your cholesterols are starting to come up. That's called metabolic syndrome, Rick. And it can be turned around. But at your age, you got to do something about it now, because if you don't, you're headed for a problem. And you continue this right now at under 50 years old with those kind of problems, you're dramatically increasing your risk of heart attack and stroke as time goes on. You haven't developed enough collateral circulation, meaning extra circulation, that, God forbid, something happens to you at this point, your chances of recovery aren't great. So you've got to decide that now's the time. You got to do something about it. You've got to turn this around. I would get out and walk 2 miles every day. If you didn't anything else, do that. Start eliminating some of the junk that that's in your diet. Start tapering that off. You have to start drinking water. If you're drinking sodas and you're drinking coffee, you're drinking black teas and so forth, get rid of them. Drink a little bit of green tea and drink a lot of water, and then begin to put more vegetables in your diet. A little bit of fruit, not a lot, maybe, 1 serving a day. Tons of lean meats. Stay away from anything that is not free-ranged or organic when you can, because now you're dealing with pesticides and preservatives and things of that nature that are going to make matters much worse. You want to increase little things like your vitamin B complex. Go to a health food store, natural store that you can get to, and get a good B complex. Get some zinc, about 30 milligrams of zinc a couple times a day. You want to increase your omega fatty acids. Go find some omega-3s from a good, reputable health food store, and you want to get that level up to about 1,800 milligrams a day. Those things won't hurt you. Your vitamin D3 is critical because that's going to drive your problem as well. So you want to take at least, I can tell you, you're probably down around your toenails. You can take 4,000 to 6,000 without too much trouble. You want to get all of your markers measured. Rick, there's so much that you can do. You don't have to live like this. You can get you can get your libido back. You can get your blood pressure down. You can get your health back. But you've got to start with some positive actions. As always, Rick, we're coming up to break, buddy. Send me a note, and I'll be more than happy to be a little bit more detailed with you. I appreciate your phone call, Rick. Thanks very much, and please, please, please take this advice and run with it. We're coming up to a break. We have to pay attention to those people who bring you Dr. Tom Roselle Live. Don't go away. When we come back, we're going to talk more about high blood pressure. Give us a call at 888-630-9625. We'll be right back after some very, very important messages.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Fibromyalgia with Dr. Bryce Miller on Wednesday, June 3rd at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Did you know that your brain and nervous system controls your strength, vitality, and health? Do you want control over that? Then join me for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that will change your life forever. Check it out, agelesshealth2015.com. That's agelesshealth2015.com or call 703-698-7117.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio, 888-630-9625. That's 888-630-9625. It's a beautiful day outside. It's Memorial Weekend. Get outside and enjoy it. Go picnic, go for a walk, go enjoy but after you listen to the show, okay? I mean, this is the important piece. Unless you have, something you can take and you continue to listen. By the way, if you want to re-listen to any of these programs, all you have to do is go to drtomroselle.com. That's drtomroselle.com. And you'll find this and tons of other things that are listed for you. You can go to roselleradio.com. That'll take you to YouTube, and we got many things there for you as well. We do it for you. We do it to educate you, to make sure that you have available the best information that we can find, to challenge you, to make sure that you understand that you have control, that there is an answer, there is a why is that. We're talking about blood pressure problems. There's many of you on the line right now we're going to get to, but I want to talk a little bit more about this resistant blood pressure problem generally, but also blood pressures that seem to spike at nighttime, and it's really opposite of which they should be, because in the morning when you get up, when you stand up, when you get up, your blood pressure should dramatically spike because you get a surge of adrenaline. It's called epinephrine and norepinephrine, and it just kicks right in and your blood pressure goes up. It's supposed to do that. It's supposed to get you going. But at nighttime, your blood pressure should start coming down. So there's reasons for that. We talked about one of them being that raises blood sugars could be fructose. That's sugars. That's fruit. That's the fruit that you eat. And anything more than about a half of a cup or a serving, maybe two at the most, of fruit during the day can spike that. And anything that is glycemic, anything that has high levels of sugar that can, or substances that convert to sugar very quickly can drive that as well. So what we want to do is we want you to be aware that there's things that you can do to make a difference. So what do we find? People that increase their blood pressure at nighttime, there's another little piece that we've been aware of, and it's kidney function. When the kidneys are not filtering the way they're supposed to, it can cause a nighttime spike in blood pressure. Why is that? Well, in acupuncture, there's a 24-hour clock. And in Chinese medicine, there are 12 primary channels, and they're named by the organ systems that they go through or the organ systems that they control. So at nighttime, early on evening, one of the energetics, one of the channels that has its highest energy is kidney meridian, kidney channel. So as the energy builds up in the kidney energetic, there seems to be a relationship in that situation. If it's aberrant, if it's trapped, if it's not moving, that the blood pressure will begin to rise at nighttime as compared to other times of the day when it seems relatively normal, it's doing okay. So we have to look at that. That's a piece. And all of a sudden I said, and acupuncture will bring that down. It will alter that. It will allow the channels to begin to move the way they're supposed to. Think about it this way. If you have a dam and a lot of water's coming and you don't have a safety valve at the bottom of the dam, that pressure is building up and building up and building up and building up. Well, in this particular situation, the water goes through, or the energy goes through faster or more abundantly, you will, at nighttime, about 5 o'clock or so on, and it starts rising. So that's one of the reasons that we see blood pressure rise at night and not during the day. The other piece is that there's this respiratory motion that pumps your spinal fluid. Your spinal fluid is produced in your brain, and as you breathe in and out, the 22 bones of your skull move in orchestration to move the spinal fluid up and down. Now, if you're sitting, your pelvis isn't moving, you can't move that spinal fluid. If your skull plates, the 22 bones, are locked in because you just had some bad dental work done, or the dentist positioned your bite the wrong way, or you've been leaning on your head, or you're in a position that causes an abnormal pressure within that spinal fluid motion, that can do it as well. So there's a lot of other things out there that can cause blood pressure, and you can't fix it simply by putting somebody on medication. It doesn't work that way. So I'm on a mission right now because, the thing that bothers me the most is when I do great things for people, we do beautiful things in our office for people, and then we get stuck with a particular problem that we can't come to full fruition with, and this one I'm going to figure out because I got to get it done. So we're going to talk a little bit more as we go on about the different supplements you can take to help blood pressures and so forth. But right now, George, thank you for being patient. How can I help you, sir?
Thanks, Dr. Roselle. A couple things. One, that Rick, the guy in West Virginia, I can only plead with a guy to join a gym if he really wants to get that thing working again. And, you go to a doctor doesn't get compensated for referring you to a gym. He only gets compensated when he writes a prescription for
That's
you.
exactly the case, unfortunately.
And the other one is the D3 that you're talking about. Naturally, how can one ingest the D3 to get what they need out of the D3?
Well, what you do, it's pretty easy. You want to take any supplement around mealtime, but go to a health food store and you want an oil suspension. Now, having said that, there are some people that can't handle oils very well, but they're usually in oil suspension. Carlson brand vitamins, and I usually don't recommend brands, but they've been tried and true for years. I used to have a health food apothecary back in Western New York, and that was one of the standard guys. They submit themselves voluntarily to inspection and so forth, and you can do that. But here's the key. You got to know what your vitamin D level is, and it's an easy test. It's no big deal. It's not expensive. And you want that vitamin D level optimally at around 75 to 80. Now you're going to protect against prostate cancer and other types of degenerative disease, and it's going to increase your mental capacity and your cardiovascular patterns and so forth. So you start low. You see where it is. If it's under 50, start taking a couple thousand milligrams or a couple thousand international units a day. And 100 days after you start, then what you want to do is go have that blood test again, and then you titrate it. In this area, because we're cave dwellers, we're inside all the time in the wintertime, in the fall, and the spring, the sun isn't direct enough to stimulate our bodies. So we want to maintain that. I take a lot of vitamin D every day. I go to work in the morning. Sometimes I'm there at 5:30 in the morning. I don't leave to 7:30 at night. So I never get outside. It's not a good thing, but that's the way my practice runs. And then I'm teaching on weekends and I'm gone. So I get in the gym. My diet's cleaner than majority of people, but I take these things as well. But you have to be careful. You don't want it up over 100 units. At 100 units, you're going to have a toxicity level, and you have to be careful with that. But that's where you start, George. But it has to be D3, not D2, and it has to be supportive. Buddy, thank you for calling. I appreciate your phone call. Barbara, how can I help you, my dear?
Yes, please. I need your help desperately on what your opinion is for a combination of acupuncture, massage therapy, and laser therapy, which I'm kind of hesitant because of any radiation risks. For conditions of depression and anxiety, stress, memory loss, varicose veins, and lower back pain.
Okay, well, let's talk about it. First of all, low-energy light laser has no side effects. It just doesn't. We have 6 lasers in our office. We use them all the time. You can program them on frequencies. There's thousands of frequencies. What you're doing is you're using quantum light to affect cellular expression and metabolism, and it resets the body. And again, it depends on what you do. So it works really well. There's laser settings, low energy light laser settings for Alzheimer's, for dementia, and you name the condition from cancer all the way through. So it works extremely well. Acupuncture balances the energetics in the body, and it could cause, if the memory patterns aren't what they should be because of loss of blood supply, acupuncture moves blood. So with dietary patterns, we use a combination of many different things. It depends on the patient. You got to get the omega fatty acid levels very high. You have to get the vitamin B12 with folic acid levels extremely high. And some people can't convert folic acid into folate, which is the active form, and you have to give them folate directly. And the ratio is 5 parts folate to 2 parts B12, but your B12, there's 3 different forms. We find for memory patterns that the best form, in our experience, is the hydroxy form. Now, what we mean is there's cyanocobalamide, there's methylcobalamide, and there's hydroxycobalamide. They're different forms. They do different things. The body needs them all, but it depends on the condition that you're treating. Again, we find that coconut oil works extremely well. The brain is plastic, means that it can reform a lot of neurological patterns and transmission. It can readapt. You have to stimulate it. You have to make sure that you're challenging it all the time. Keep the damaging foods out of your body, the things that oxidize and destroy tissue: sugars, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, GMOs, and those things don't belong in your diet. And if they're not organic, there's an issue with that. But there's a lot that can be done, Barbara. That's just the beginning. That's the tip of the iceberg. Send me a note and I'll give you a punch list. But don't be afraid of the things that you're doing. You're doing a good job if you're following those. There's other things that you can add to it. I really appreciate it very, very much. 888-630-9625, 888-630-9625. We're talking about hypertension, blood pressure problems. And there's several more of you on the line, and I'm going to try to get to you as quickly as I possibly can. We talked about supplements. We talked about there are things that cause blood pressure to go up at different times of the day. Depending on when it goes up tells the story of, what may be the problem. So, for example, if your blood pressure spiked at 1, 2 o'clock in the morning, it may be a liver function problem. If your blood pressure spiked late morning, it may be a heart problem. But in a particular situation that's got my interest, my attention, we've got a blood pressure that's going up before bedtime, so we want to know what the energetics are that are associated with that. And one of the things can be kidney function and other related situations. So we look at the kidney function. We look at blood sugars in the form of fruit. That can do it too. Some people are so sensitive to fructose, and you can't find it in normal testing. And even the muscle reactive testing that we do, which is better than most every other test that you're going to have done. But if that fructose and then broken down into other sub-fractions can cause the blood pressure to spike. So I'm going to have more information for you this as we go on. There's a lot of things that you can do. You bet that, it's a problem when it can't be understood or it can't be controlled, and you really have to make sure that you look at all the pieces. And we're moving spinal fluid function. We're making sure that neurologically the body's communicating the way it's supposed to. We're making sure that the energetics are up. Things like calcium, magnesium, they have to be balanced. Daily calcium, magnesium supplementation can be useful in bringing down blood pressure problems, especially if it's a blood pressure is on the high end of high. So if you have blood pressure that's up there all the time and not coming down, and we're not just talking about a situational blood pressure that's only high at one time or another, magnesium, particularly in the form of the aspartate form, drops the blood pressure. Again, you really need to have somebody who knows what they're doing to tell you how to handle this, but also remember, it can be a neurological pattern, it can be other things. Vitamin C and vitamin E also help bring down blood pressure. And there are different forms, again, of this product. There's something called D-alpha tocopherol. There's D-beta tocopherol. And by the way, I'm going to give you a tip. If you look at a vitamin E, like Edward bottle, and you see the letter D like David, and you see an L like Louis next to it, before it says tocopherol, or before it says alpha, so you see DL, alpha tocopherol, or DL beta tocopherol, that's a synthetic. It's not worth your money. It doesn't work. You can put it on your skin. That's great. You can, it'll help keep your skin nice, but it's not going to do anything for the things that you want to deal with. That's a synthetic form of vitamin E. You're wasting your money. Olive leaf extract. If you're taking olive leaves, and they're good for a lot of things. Parasite's one of them, by the way, but it also will help drive blood pressure down. Olive leaf in a dried form, you can take it in a powdered form, about maybe a teaspoon, a teaspoon several times a day. And it also seems to work. You can make it in a tea, you can take it directly, you can do a lot of different things. We talked about acupuncture. And there's a lot of different breathing patterns that will also affect acupuncture, like affecting your blood pressure, closing off your nostril on one side and breathing in very deeply, filling your abdomen first, holding the inhalation for about a count of 8, and then slowly letting it go, and switching back and forth, one side, then the other, one side, then the other, and you do that for a count of, or maybe 10, 12 repetitions, and do it 2-3 times a day. That also is an old trick I've used for many years with patients that have problems with the skull bones, with the cranial plates. It begins to move them in a more fundamental reciprocating way. So there's a lot of different ways of fixing this problem. We have several people still on the line. When we come back from the next break, we will get and take your questions and see what we can do to make a difference. We're here every Sunday trying to bring you some intimate information. I get crazy when I can't find something that works for you, so I start doing research, and that's all I can think about for days and days on time. And I want to make sure that I keep you updated and keep you accurate and give you the best that I can possibly give you. We're coming up to a break. We have to listen to some people that bring you this program, and that's why we're able to be here, and that's why we continue. Remember, this program really needs to be like 3 hours long, so we can sit here and handle everything. We'll be right back. This is Dr. Tom Roselle.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's how you find me when I'm on the air. And if you'd like to talk to us when we're not here, you go to rosellecare.com. That's ROSELLECARE.com, and send us a note. If you want to talk to one of my docs, they'll get back to you. You just call our office at 703-698-7117. We'll do everything we can to point you in the right direction. Let's see if we can pick off a few of these phone calls because many of you have been very, very patient. Mary, how can I help you? Thank you.
Hi, how are you?
I'm doing well. What can I do for you?
Appreciate your intellect and your help to everyone.
Well, you're kind.
I wanted to, there's so many questions.
Take one. We don't have a lot of time. Take one.
Every summer, I first of all, I was a preemie baby, adopted at 4 months old. Every summer, for as long as I can remember, first of all, as a kid, I used to faint in the showers. We went up to Mount Blanc. I fainted. They had to carry me off at 17 years old down the tram on a stretcher. Every summer, I don't have to be out in the heat hardly at all. And I have to sometimes be taken to the hospital, given intravenous fluids, vomiting.
So let me ask you a quick question. Does that happen more so when you change positions? Like if you get from a sitting to a standing position, you get that feeling like you want to pass out?
No, I mean this is just an overall. No, I mean I don't think it has anything to do with that. And
okay.
So I just spent last week in the hospital again.
And they can't come up with anything, right?
No, they just tell me I'm dehydrated. And next question is how much water should we be drinking? And
okay,
you can't have fruit.
It's real. Well, it's not. I didn't say you can't have fruit. I said if you're sensitive to it, you can, so you got to watch the sugars in your diet. You have to make sure you're getting enough protein in your system. All of us should, from all different sources, a minimum, in my opinion, around 75 grams of protein a day. You can get online, you can figure that out. There's ways of making that happen. Your amount of water that you want to have, take your body weight, divide it by 2.2, and whatever that number is the number of ounces of water that you should be drinking every day. Mary, I wish we had some more time. Send me a note, and I'll deal with this. I appreciate your phone call. I want to take one more call. Betsy from Williamsports. You're up in the Maryland area, right?
Yes, sir.
Okay,
yes, sir.
Real quick. I got about 40 seconds.
I had a thermography done on half a body, and I have 3 things that showed up on it. My doctor isn't updated with thermography, but it says that the back myofascial dysfunction involving the paraspinal, muscular throughout the whole length of the spine. It says that the oblique, abdominal oblique.
Let me handle it real quick, honey. We're coming up to the end of the program. Thermographic imaging shows. What that shows is the heat signal that is caused by inflammation. So it's telling you those muscles aren't working the way they're supposed to. You need to see somebody that does structural work, a good chiropractor or a good myofascial therapist, and they can help you with that. Thermographic imaging is great. It's one of the best things. We do it in our office. It's phenomenal. We'll talk about that fully in another program. We're coming up to the end of the program. This is Dr. Tom Roselle. See you next time. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Thank you.